we're laughing, but all of us have seen the tragic results of these dietary guidelines, which basically gave us the red light to overindulge in empty carbohydrate foods, the very foods USDA wants us to eat. I would like to comment on one thing that Pam said. The Dietary Guidelines Committee is very cagey, and in all of their deliberations, they did not use the word saturated fat very much, and they never talked about trans fats except to say that that problem had been solved, which it hasn't been. But they have lumped the two together and called them solid fats. So that's the term that's being used now, tarring butter and meat fats with the same brush as the trans fats. And I think it's very important to realize that in the human body, these saturated fats are not solid. They are soft. And it is simply because we are warm-blooded that we need saturated fats. Otherwise, there's not enough stability to the cell membranes. Cold-blooded animals is where you get your omega-3s and your unsaturated fats. All warm-blooded animals, whether it's a cow or a human, will either consume or make saturated fat. Think of a cow. A cow eats grass all day long, and yet it makes this saturated fat, which it needs for all its functions. So be very careful of that word solid fat. And by the way, the trans fats are solid in the body, but the saturated fats are soft in the body. Well, we've heard some very interesting speakers. I'm so glad we got all these different viewpoints. You've heard from people really in the front lines of battle, and I'm sure you have questions. We do have a microphone. We would like to get all of this in our video, so if you have a question, I think we'll ask you to come up and use the microphone. I think that'll keep it orderly, and then please tell us who you're presenting your question to, and that person can answer with the microphone. Yes, please come up. Yeah.
Hi, I'm Katie Steinmetz with Times DC Bureau. Just wondering if any of you all have strong opinions one way or the other on the First Lady's campaign against obesity. If she's doing that effectively, might do it better.
Okay, I'll start with that, and I'm sure we have some others. The First Lady, when she came into the White House in an interview, said, "We're an eggs and bacon family." That's what her children are getting for breakfast. There is the implied message in her campaign, however, that these foods are bad. And my concern is that fruits and vegetables are being used as kind of the pinup girl, the call girl, and they're very colorful, and everybody can say, yes, they're fine. There's no downside to fruits and vegetables. Well, there is if you eat too much fruit, for sure. And it kind of draws people in to the rest of the message, which is low fat, low salt, high carb. That's my concern about fruits and vegetables, that they're being used to kind of entice people into the wrong type of diet.
So I agree with Sally that the fruits and vegetables, this idea that we need to, eat this rainbow of colorful fruits and vegetables is a distraction from the fact that we're also being asked to eat these highly processed, plant-based grain and cereal products that are not real food. And she's made the focus of her campaign to end obesity in a generation. But that disregards the science that we know that the food that we eat now in America, that base of that pyramid, sends a message to our genetic material. So if you think of food is information that about the environment around you. That food goes into your body and it is giving your DNA information. And if you're not eating enough protein and you're not eating enough fat and you're not eating enough cholesterol, and instead you're eating lots and lots of plants, namely wheat, corn, and soy, that food information tells your body that your nutritional environment is devoid of real food, the food that it needs. And it sets up an environment in your body to increase the enzymes that allow you to store fat and make fat. Now, if you feed those foods, as Pam said, to a woman who's pregnant, you have a child that's born with that metabolism in place. How are you going to end that in a generation? Getting that kid to eat less and move more, are you going to tell a 2-year-old that he needs to eat less and move more? That goes against every mothering instinct in me. That just doesn't work. We need to eat right. The movement will happen. As Dr. Carlson said, if you feed people the right foods, exercise will happen. People get active. This is what I saw in clinic all the time. People come in, oh, please don't tell me to exercise. We put them on the right diet, and they would come in a few months and ask us if it was okay to exercise. So we're not going to end obesity in a generation until we start changing what mothers eat. It just cannot happen. Our genetic material is not going to allow it to happen.
I think that's the classic, what is it, the Let's Move campaign, right? A very basic tenet I teach my patients is that sugar is sugar is sugar. And no matter where the sugar molecule comes from, it's still sugar. So encouraging the consumption of more whole grains, I believe they're changing the dough and the pizza to whole grain dough and encouraging more whole grains, whatnot. And we learned before, biochemical fact, fructose and glucose are the starting points for the synthesis of cholesterol. So switching to whole grain products and encouraging more fruit is going to actually increase the obesity problem, the heart disease problem, make diabetes less controllable. We're actually seeing type 2 diabetes now in children. And when I was growing up in medicine many years ago, it was referred to as maturity onset diabetes. And you can't use that term now because we're seeing it in adolescents, we're seeing it in children under the age of 10. So substituting whole grains and multigrains and fruit, to me, it just tells me you don't understand the basic tenet that sugar is sugar is sugar. Looking at it a little bit further, a sugar molecule from a whole grain piece of bread is the same, let's say, glucose molecule you get from white bread. So when that glucose molecule gets to the level of the cell doesn't go, oh, well, you came from whole grain bread. I'm going to do great things with you, and you came from white bread, so, or a Snickers bar. No. Intracellularly, what happens is what happens biochemically. The glucose molecule or fructose molecule is converted into plaque-forming deadly cholesterol, and we make more fat with it. So the Let's Move campaign, encouraging more fruits and vegetables. And I don't pick on green leafy vegetables, but I do pick on the starchy vegetables. That is carrots. Corn is a grain. I pick on that as well. So I am definitely not supporting this Let's Move campaign. Thank you.
Thank you. Yes, Ed.
Thank you. On this in particular,
Like a rock star.
oh, I see. Okay, thank you. The road to hell was paved with good intentions. But in terms of this wish to reduce obesity, it takes more than good intentions. It takes, in fact, science. And I've seen reports that the First Lady's counselor in this is the chef who was really, of the White House, who's not really a trained nutritionist. And most of the ideas behind these programs basically are this mantra, low sugar, low fat, low salt, without really thinking about it and looking at the data itself. So, if we use the dietary guidelines in the past as an indication, this program is although it has good intentions, is doomed to failure unless, in fact, the real evidence is considered. Thank you.
On the Let's Move program, I believe that the new guidelines call for 60 or 90 minutes of exercise every day in the schools. And for a child who's sick or who's overweight, who is tired from their high-carb diet, this is like torture. And, to me, it's like a vice that's being put on our growing children, a deficient diet, and then you're supposed to move, and exercise is very depleting, particularly depleting of the fat-soluble vitamins that we get in animal fats. And it just compounds the problem. It exacerbates the problem. I think Pam had a comment here.
I received an email from the American Dietetic Association, which I'm a member of, and I was, oh, this is interesting. I'd like to be involved with this. They're trying to get volunteers from the American Dietetics Association, registered dietitians like myself, to go out to schools and send the message of Mrs. Obama's Let's Move campaign and help it get enacted. I'd really love to do that, but I don't think they want to hear my message, and it really breaks my heart because I feel like it could do a lot of good, and until the dietary guidelines, you know, recognize the real truth, I won't be able to do that type of good.
We also have groups of dietitians going to immigrants and telling them that their traditional diet is bad for them, and indoctrinating them into the breakfast cereals and the vegetable oils and so forth, telling them not to cook in lard, not to eat their traditional beans and so forth. It's really, we really have to look very carefully at ourselves as a society and what we're doing here, because we are undermining everybody's health, everybody's dietary heritage. And in fact, the dietary guidelines, the school lunch program, that was one of the original goals, was to get children to forget their culinary heritage.
Hello, Sally. This is Merrick Johnson with Jimmy Doan and Christian Chocolates. I was kind of hoping the fourth group would be chocolate, but I guess it didn't quite work out that way. I know how you feel about chocolate, and we've talked about this before. I kind of feel the odd man out because I see that chocolate has many health benefits, from high concentrations of iron and zinc and B2 and magnesium and calcium and I mean, it's really, I think it's almost a vegetable. Granted, there's some caffeine, and I hope that's your only issue with it. But an ounce of really good bittersweet chocolate has less than the amount of caffeine in a cup of tea. So
The amount of fat?
Caffeine in a cup, it has less caffeine than a cup of tea. And you know that I make my own butter from local grass-fed cream, and I mean, I use the purest, finest, soy-free, GMO-free ingredients. And I don't feel comfortable being lumped into this group of don't eat chocolate, because my motto is eat more chocolate.
Yeah.
Now, it's better chocolate, right? It's pure chocolate. And yeah, I mean, it's filled with antioxidants, which we need. You mentioned several Swedish studies. There was one Swedish study which said that women who ate 1 ounce of bittersweet chocolate a day during their pregnancy had healthier, happier babies by 40%. And I would consider that to be statistically significant. So, I mean, I'm addressing all of you, especially you, Dr. Peterson, as a biochemist. I think the chemistry of chocolate proves itself, worth the minimum amount of caffeine that you would get. But I will stand out and take what arrows you have. Thank you.
Yeah, I don't think very many people can eat just one small piece of bittersweet chocolate a day. Chocolate is addictive. I can't eat one piece a day. I have to absolutely keep it out of the house. And it's high in sugar. We can't make an exception just because it's chocolate. Maybe someone else would like to address this. Yeah?